Well, I'm sure for most people, including myself, you look back at last week and it probably feels like a month, if not longer ago at this point. So what I would say is, as we all know, and there's really no point in blame, but too little, too late. We really didn't get to segregate the patients as well as we could have or should have. The testing was not readily available, and even when it was done, it was very slow to respond to hear the results. We ended up having to commingle patients on floors. So as a result of this, I think that it's important to test as many people as we can so we can see where the virus is. But the reality is, in order to best take care of patients now, as a result of the commingling and the slow response, we have to treat everybody in the hospitals as if they're positive now. And that includes the nurses. The best way to approach this now is to assume that every patient you're taking care of is positive and that every nurse who's taking care of a patient is positive. So that means we really do need to get the best protection in the hands of everybody in direct care of the patients. We need to limit the number of people going into the rooms. I think it's best that the registered nurses be the primary people going into the rooms. Let's try to keep everybody out of the rooms as much as possible, and to get the right PPE on the nurses going in to take care of the patients. I think the concern that patients will be afraid, I think is mitigated by nurses obviously explaining to them, look, we're trying to do the very best we can to protect you from getting the virus, and from not me to get the virus as well, because we certainly don't want to see the nursing workforce or anybody else who's providing direct care sick and out for 14 days when we need them desperately at the bedside. So we need to try to get the N95s in the hands of the people in direct care, and I think everybody's working on that. I don't know how familiar people are, but there's another piece of equipment called PAPR, which is essentially a purifying respirator. It's a hood with a little kind of battery pack on it that helps circulate the fresh air into the hood. It sounds much bigger than it is, but the reality is you get the benefit of the N95, but the nice thing about it is it's reusable. And that's going to be one of the things on hindsight, I think, that we look at that would have been nice to have for everybody to have. But nonetheless, there are folks that are in the field today that have them, and the firefighters and first responders. I think it'd be great if we can ask the firefighters and others to use the PAPRs when they're working with patients and instead free up the N95s into the hospitals. And we will vigilantly work to see if we can get our hands on PAPRs, and I think the hospital should do the same, because if we can move the ICU folks into using PAPRs and free up N95s for the floors, that would be useful as well right now. And as far as anybody not in the rooms but walking around the hospitals, at this point, just as we would anywhere, let's assume that everybody potentially is a positive. So therefore, wear the regular surgical mask whenever you're out and around the hospital. Really good methods of protection so that we're trying to slow the spread among the healthcare workers as well as slow it out in the general public. I think the next biggest step that we're looking at is, because you almost have to look at it, all right, whatever I'm talking about now is almost last week's problem. So we have to try to think of what do we need to be talking about now that's next week's problem. And the reality of that is we really need to identify inside the hospitals those areas that can be converted to intensive care beds. And the staff right now, we cannot see any reduction in service personnel at all in healthcare. We need all the staff that are available that maybe because of the elective surgeries being reduced or hopefully stopped altogether, those folks can be retrained and utilized. And so we need to identify ICU areas, and we need to train the staff appropriately to be able to staff those areas. And along with that, it sounds unusual, but this has happened in other areas, and I think we have to be prepared for it, as people have heard, because there's really not the availability of a ton of ventilators out there, although I think there's a real push to try to get ventilators produced as well right now. But we need to understand how to be able to hook up more than one patient onto one ventilator. And that's a training that can be happening right now for next week's problem. One area that we're not finished with, but I know people are working hard at, that will help as well, I know we've been pushing for both housing and parking. Those remain works in progress, but if we can get them done this week, we'd like to see the nurses and those in providing direct care to be able to have housing close to the hospital so that they're not actually going back into their homes if they can't due to a variety of reasons, immunosuppressed family members or whatever it is, that they could have housing close to the hospitals. And also dorm rooms or whatnot available potentially for if anybody is being put on quarantine that really can't return home, that those should be made available. And with that, we still have a problem with shuttling people in and putting them like sardines on shuttle buses, which is obviously counterintuitive to everything that we're doing right now. And So getting this parking freed up for those who are traveling back and forth, let's get them into the garages or into parking lots, wherever they're freed up, and not have these employee shuttle buses squished like sardines, which is obviously the exact opposite of what we're asking everybody to do, including the public. For the public, I know it's been awkward and difficult for them, and we're actually calling for an even higher level of shelter in place, however you want to deem it, to really do even more to shut things down. I know that San Francisco is moving or has gone in that direction. I know that Nantucket has, and it feels awkward, I think, for people as we try to navigate our way through that, but I think it's helping. And I think if we can do even more of it, just as we need to do more inside the hospitals, we need the public to do as much as they can. So any kind of further restriction to try to diminish the social gathering would be extremely helpful. And I would ask the public to look at it like this almost. If there was a medicine that you could take right now, a vaccine, it would be really restricting any kind of social interaction. And I think that you can add to that there's a lot of folks out trying to help making cloth masks that we really can't use as much inside the hospital setting because of the what actually acts to cross the barrier in the cloth. But on the other hand, out in the public, wearing the mask, a cloth mask, or even disposable ones if you have it, if you're out in the public when you have to go to the grocery store, because you are going to, I know, have to get food and do some things, but be smart, go ahead and wear the mask. I think it keeps you from touching your face. And in addition, it kind of keeps everybody vigilant and aware of it, keeping their social distance. So that's another step I think that's a bit different for us culturally. I think some other countries have done this more because of pollution issues, if nothing else. But I think it's probably another mechanism, a step. And I've seen a lot of creativity. And so I would ask even the young kids who are really not getting symptoms but shedding this thing twice as fast as influenza, if we can get them to wear the masks or the scarves with, I'm sure, some unique designs, they could really go a long way to helping. You could almost consider that if you take those steps, further restriction and wearing the mask yourselves, I think you should really consider it that you might have yourselves saved one more life. I think a small thing, I know people are looking for donations and whatever they can do right now, and we are actually going to look for what are the most appropriate places where if you wanted to donate money, you could. It's really important, obviously, that, there's going to be those unscrupulous people out there, and we would not want to make a recommendation to anybody to a place that didn't actually get the funds in the hands of people that desperately need it. And there are so many people that need it desperately for a variety of different reasons, not the least of which is the number of people that are out of work right now. So we'll work to try to come up with a link for places where you can donate money, which is one thing that you could do. But also a very small thing that one of the nurses had mentioned that I thought was just, simple but very easy, beyond the making masks for the public themselves as well. But additionally, there's not a lot of opportunity to get to the cafeterias now. The folks are really pretty working out straight on the floors now. And just the restriction of not wanting people to necessarily be in a cafeteria setting. And they were saying that, if you can get boxes of individualized packages of snacks, whether it be like the mini Fig Newtons or whatever that come in a larger box, the floors could use those, not only for the nurses and the other healthcare workers, but for the patients themselves, just to get through the shift where they really can't get down to the cafeteria. It's just not appropriate, or there's just not the ability to do so. So that's like a small thing, and I think as those kind of creative ideas come up, we'll share them. But it seems small, but you know what? If you're somebody who's been out straight up all night working with these patients and you're really hungry and you can't get to anything, and there it is for you. Somebody's managed to drop off a box and it's just enough to get you over the edge. It is very much appreciated. And as I said, as we come up with more ideas for folks that are passed through for the nurses themselves, we will most definitely share them. As always, be vigilant with the hand washing, the mask wearing, the social distancing. All of those things are extremely important. And just kind of, I guess, look in on your neighbors from 6 feet. And just be as supportive as we all can, because this is going to be a while left to go, and the surge hasn't really reached its peak yet. So I think kind of hunker down. We're asking the nurses to write diaries of their shifts, because what we don't want to lose is what's happening right now, so that when we all get through this, what will be the smartest thing is if we can look back and make things different so it never happens again.